Hello everyone, and welcome to today's video lecture on treatment modalities for substance abuse and addiction. This is an introductory lecture. If you are interested in diving deeper into the subject of treatment for addiction and substance abuse, then you would need to enroll in the Next Level Up course in treatment approaches for addiction and substance abuse. So first of all, what is a treatment modality? So a treatment modality can also be called a treatment approach, and what a treatment approach or a treatment modality is a method used to treat a patient for a particular condition. So in this case, we're discussing how to treat substance use disorders, whether it's alcohol use disorder, opioid use disorder, marijuana use disorder, cocaine use disorder, nicotine use disorder, or a combination of any of those use disorders. Often people are also treated for co-occurring disorders as well as trauma in addiction treatment, which you will study in depth in higher level courses. So some examples of treatment modalities commonly used to treat substance abuse include behavioral therapies, both inpatient settings as well as outpatient settings. So an inpatient setting would be something like Valley Vista Retreat, Brattleboro Retreat, or any type of treatment facility where a person stays overnight for an extended period of time and receives comprehensive intensive treatment within that facility. Outpatient treatment would be when a person is receiving treatment, whether it is with pharmacological approaches such as Suboxone or Methadone or Vivitrol or Chantrix through a physician, as well as outpatient counseling. So that is when a person is receiving treatment at an office, a hospital setting, somewhere where they go for their appointments, but they're not necessarily staying overnight. So some of the behavioral therapies that are used within these settings include cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing, as well as traditional psychotherapy. Rational emotive behavior therapy is also used, as well as person-centered therapy, which is a modality that is influenced by a Rogerian approach, which emphasizes a genuine connection between the counselor and the client, as well as the counselor having unconditional positive regard for the patient, meaning that no matter what the patient does or how they are or are not doing in their recovery, the counselor still creates a therapeutic relationship with that client that is unconditionally supportive and non-judgmental. There's also integrative approaches which combine multiple different modalities, as well as creative approaches that would include things like EMDR, eye movement desensitization therapy, which is also often used for trauma, as well as therapies like nature-based counseling, art therapies, yoga, or other somatosensory-based therapies, as well as mindfulness therapies and hypnotherapies. So hypnosis for quitting substances. One commonly used form of hypnotherapy would be for tobacco cessation, quitting smoking cigarettes or chewing tobacco. So another common and very successful type of modality used in the treatment of substance abuse is medication-assisted treatment. So medication-assisted treatment has been around in Vermont for over 10 years, specifically in the Northeast Kingdom, and one particular business that comes to mind that provides medication-assisted treatment is the BART Clinic. They have a clinic in Newport, St. Johnsbury, as well as Berlin and St. Albans. They're a company that's a behavioral therapy company that's originally based in Fresno, California. Medication-assisted treatment is also offered in places like Hanover, New Hampshire, as well as Northern Counties Healthcare and other private doctors' offices. So medication-assisted treatment is the use of medications in combination with counseling and behavioral therapies for the treatment of substance use disorders. So how does it work? So first of all, a person who is at the stage of recovery where they're admitting that they have a problem and they're seeking help for it, a person would be able to go to a clinic, for example, such as BART, and register for a pre-screening, at which point that person would then come in for an interview with a counselor and be asked a series of questions in regards to what they're using, how much they're using, what types of withdrawal symptoms they may be having, or what type of intoxication symptoms they may be having. At this point, the person is also providing with their contact information and discussing, in a nutshell, what's going on with them at that point in their life. At this point, a person also figures out how they're going to pay for the treatment. They provide a urine sample for a urine drug screen, and this way the clinic is able to diagnose based on the urine drug screen what substances are in this person's system, and then depending on when there are openings at that particular clinic, a person is then called in at a later time for complete intake, which is about a 2 to 2.5 hour process where a person sits with a counselor and completes multiple different types of assessments and screening tools to determine the severity of their use disorder and whether or not there are other co-occurring disorders that need to be treated at that time. The client then also meets with a nurse and at some point the physician, the prescribing physician, to determine whether or not medication-assisted treatment is appropriate for this person, and if so, are they going to be placed on Suboxone or methadone, and occasionally Vivitrol as well. So that is just a very brief overview of how that process works. And so one question that comes to mind for a lot of folks when they're first learning about medication-assisted treatment is, how is it healthy to be substituting one substance that has addictive properties for another one? How is that going to, help cure this person of their disease, of their substance use disorder? So one important philosophy to understand when learning about medication-assisted treatment as well as substance abuse and addiction treatment in general is a strategy called the harm reduction model. So harm reduction is a philosophy, a set of strategies, as well as sometimes a policy, which aims at reducing negative consequences associated with drug use. So it's a philosophy that aims to take away the stigma, to take away the stereotype, to take away the shame that is often associated with addiction, the shame that often accompanies addiction and recovery. So it is also a movement for social justice that's built on a belief and respect for the human rights of people who use drugs. So it is a movement, a social justice movement, that aims to defend the rights of people who are addicted to substances. Just because someone is addicted to a substance doesn't mean that they're not a worthy person or that they don't deserve treatment or adequate medical care. So some strategies that are included under harm reduction would be things like safe use. So that could be an example of like a needle exchange service where they're not telling a person, no, don't use, but they're saying, since we can't stop you from using, we're at least going to provide you with clean needles and clean tools to use with, as well as a place to drop off used needles, and this helps in the prevention of the spread of diseases such as HIV and AIDS. And this can also sometimes be the foot in the door that a person who is addicted to substances needs for treatment, where they may feel this unconditional positive regard and this support coming from the people at the needle exchange, and that might provide them with the encouragement to pursue treatment, for example. So again, harm reduction is about meeting people where they are at. It's about being non-judgmental. It's about promoting safer use. It's about promoting recovery and understanding that this does not happen for everyone in the same way, and that relapses are often part of recovery. And that doesn't mean that a person isn't trying or that they aren't getting better. So it's also based in the idea that, positive is more than negative, that we will be able to help more people by approaching them with a positive, encouraging attitude than with a punishing attitude, for example. So how would harm reduction work in a clinical setting? So harm reduction could work in a clinical setting, for example, by not penalizing people for relapses. So let's say that you have a client who's new to the clinic, and the first month, although they're still being prescribed Suboxone or Methadone, their drug screens are coming up positive for heroin or morphine or codeine or oxycodone, or maybe they're also coming up positive for benzodiazepines and THC, or they're coming in smelling like alcohol and blowing numbers on the BAC every morning. This wouldn't mean that they would get kicked out of treatment. This doesn't mean that they're failing at treatment either. It means that they're in the early stages of recovery. And rather than punish someone for struggling, the person is allowed to continue through treatment, and depending on the clinic that this person is at or the doctor's office, they'll each have their own specific set of rules as to what would be tolerated and what would not be. For example, many doctors aren't concerned about positive THC drug screens, at least in Vermont, because the main goal is to help this person stop using heroin IV, for example. So let's say they've been clean from using needles for 5 years and maintained this sobriety from opiates as well as from needle usage. Is it really going to be helpful to that client or to the community to penalize this person and take away their drug treatment because they have a THC positive drug screen? So that's one example. Another point that I think is important to clarify is that if a person who's being prescribed methadone or Suboxone has a particular number of positive drug screens for opiates or benzos or alcohol, and this is putting them at physical risk of harm or some type of an overdose, then the person would be tapered off of their methadone or their Suboxone, not because they are being penalized and losing their treatment, but because of safety issues. So if a person is misusing their Suboxone or methadone, this would be another example when a person could be tapered or weaned off of the medication. So again, in light of harm reduction, the idea is that we're focusing on what is in the best interest of the patient's health and the best interest of their life and their recovery. So if a person is not at risk of dying from overdose and happens to have a positive cocaine urine drug screen, the specific urine drug screen would be addressed with the client. Why was there a relapse? Or why is every drug screen coming up THC positive? What are the underlying mitigating reasons for that use, and trying to get at the root of the use from a psycho-emotional place rather than purely from looking at the chemical dependency alone. So harm reduction, again, is about providing a place for the patient where they feel safe and supported through their recovery process, because it doesn't always happen right away, and I know very few cases of people recovering from severe substance use disorder where relapse wasn't an issue. So I'm going to go ahead and end this video, and then we will get into the specifics of buprenorphine and methadone here in the next video. Thanks very much.